Athero, yeah, raised blood pressure, raised insulin, blood glucose, insulin resistance, and glucose intolerance. And all of these are a pro-inflammatory state, which we will talk about just now. We're now going to examine the criteria by the Society of Endocrinology, Metabolism, and Diabetes of South Africa to define metabolic syndrome. You'll notice here on the left column the elevated waist circumference, elevated triglycerides and reduced high-density lipoprotein, elevated blood pressure, and elevated fasting glucose. Obviously, if the patient is already on treatment for these conditions, that would fulfill the requirements of the criteria. Now, interesting that there are differences in different areas of the world regarding abdominal circumference, but this seems to relate mostly to men rather than to women. For instance, in sub-Saharan Africa and in Western Europe, the abdominal circumference is much the same. Greater than 94 is considered a cutoff, whereas in Central Asia, for instance, the Indian subcontinent, this is 90, and in Eastern Asia, Orient, it is less than 85 centimeters or more than 85 centimeters. In Western populations, 1 in 4 people is associated or is affected by metabolic syndrome. And I think in South Africa, this figure is also going up quite dramatically. It's become one of the major public health challenges worldwide, and metabolic syndrome increases the risk of developing diabetes by 5-fold and doubles the risk of atherosclerotic cardiovascular disease. Now, looking at some of the different causes of this, one of the first ones we'll mention is the role of saturated fat. It has been known for some time that saturated fat is a significant contributor to insulin resistance. And these two studies here show that a single dose of palm oil, by the way, which is about 50% saturated fat, decreases whole body, hepatic, and adipose tissue insulin sensitivity by, you can see, between 25 or between 15 and 34%. It's also noteworthy that the dietary intake of saturated fat is a likely contributor to non-alcoholic fatty liver disease and insulin resistance. Obviously, there are many factors, but this seems to be a major contributor. If saturated fatty acids as a percentage of total energy were to decrease from 14 to 8%, there would be an 18% decrease in fasting insulin and a 25% decrease in postprandial insulin. That's quite significant, isn't it? Now, a concept not universally accepted as a cause of insulin resistance is intramyocellular lipid, together with intrahepatocellular lipid. This is fat globules that are can be seen with a magnetic resonance spectroscopy in vivo and within those cells. And it's been found that there's a significant increase in insulin resistance with the more fat globules that occur in muscles and liver cells. And a reduction in intake of dietary fat, particularly saturated fat, reduces intramyocellular lipid and increases insulin sensitivity. Exercise can also do the same thing, as well as a calorie restriction. Here are some pictures taken with a magnetic resonance spectroscope, and you will notice on the top left-hand picture here that there are relatively few of these little green spots which represent saturated fat or lipid globules, compared to this one over here where there are a far greater number, and here's a higher resolution picture of the same thing. And there's a well-known relationship between the number of globules seen on a magnetic resonance spectroscope compared to the incidence of insulin resistance. Chronic inflammation is considered to be the common denominator of most non-communicable diseases. And the relevance of this helps us to assess the effect of our management by monitoring inflammatory markers. You'll notice that insulin resistance, type 2 diabetes is associated, obesity, atherosclerosis, hypertension, cancer, autoimmune diseases, obviously, but then also neurodegenerative diseases like Alzheimer's disease, and even affective disorders like depression and anxiety. Now, what about the role of dietary fiber? Way back in the 1960s and 1970s, two of the most prominent investigators in this area were Doctors Dennis Burkett, who was a surgeon working in Kampala in Uganda, and Dr. A.R.P. Walker, who worked in the Medical Research Council and in the laboratory, the state laboratory in South Africa for many, many years. And they noticed that there were significant differences between the disease patterns of rural Africans compared to Westerners. And the conditions that they identified were things like type 2 diabetes, atherosclerosis, colon polyps and cancer, obesity, and then of course dental caries, appendicitis and diverticulosis. Dr. Walker did much research comparing disease profiles between different race groups in South Africa, and also changes in disease profiles as rural people became urbanized. And so dietary fiber was identified as a major factor in the above conditions. Now, dietary fiber provides both prebiotics and stimulates the growth of probiotics. Prebiotics are fiber itself, residual starches, and unrefined carbohydrates are rich in dietary fiber. There are mostly two types, the water-soluble and water-insoluble. Water-soluble examples are like oats bran, whereas insoluble is like wheat bran. There are up to 30 different subtypes, and it's of note that only plant sources provide fiber. There are no sources of fiber in animal products. And the more varieties of fiber that are ingested, the greater the diversity and the abundance of microbiota. A Western diet which is high in animal protein and fat and low in fiber results in a marked decrease in the number of total bacteria, and especially the ones that are responsible for producing short-chain fatty acids, which we will talk about in the following slides. Now notice this introduction to a study that was done on diabetes, and it was done, by the way, in 2020 by Dr. Lee et al. So it's quite a recent study. In this review, he says, we summarize the recent microbiome studies related to diabetes disease and discuss the key findings that show the early emerging potential causal roles for diabetes. It appears that the human oral and gut microbiota are deeply interdigitated with diabetes. We paint a clear picture of how strongly microbes are linked and associated both positively and negatively with the fundamental and essential parts of diabetes in humans. The microflora seems to have an endless capacity to impact and transform diabetes. Obviously, there are some microflora that, or types of microflora that are beneficial and others that are non-beneficial. Human metabolism is intimately connected to a healthy microbiota. And we will talk about short-chain fatty acids a little bit later on, but these are particularly relevant to the management of type 2 diabetes, as well as many other physiological functions. Diabetic patients have a very different microbiota spectrum with less short-chain fatty acid producing bacteria compared to non-diabetic patients. Another substance that is produced by bacteria is lipopolysaccharides. These are derived from cell walls of gram-negative bacteria. And these seem to stimulate an immune cascade, and they cause not only inflammation in the subepithelial layers of the lining of the intestine, but also chronic systemic inflammation. TLR4 signaling is considered to be one of the main triggers of the obesity-induced inflammatory response, and saturated fatty acids can cause insulin resistance and low-grade inflammation by activating this TLR4 signaling pathway. Let's talk now about short-chain fatty acids. These are composed mostly of acetic acid, propionic acid, and probably the most important, butyric acid. A decrease in butyrate-producing bacteria, and obviously then a reduction in the amount of butyrate, can increase intestinal permeability, the so-called leaky gut syndrome. Butyrate stimulates the production of tight junction proteins, and this then positively affects the mucosal barrier. Butyrate also influences the upregulation of 5-AMP, which affects insulin resistance and inflammation. It's also been shown to play a role in human feeding behavior. And butyrate-producing Faecalibacterium prausnitzii and Roseburia species are reduced in both prediabetics and type 2 diabetic patients, as we mentioned earlier. Now, this is a brilliant illustration which shows the difference in gut appearances with a plant and fiber-rich diet versus the typical Western diet. You'll notice here on the left-hand side a dietary fiber, many bacteria that are busy digesting that, which results in increase in bacterial diversity, production of short-chain fatty acids. You notice a very thick mucus layer with numerous different types of bacteria. The goblet cells which produce the mucus are healthy and functioning very well. There's relatively little, we'll put it this way, the integrity of the epithelium is intact, and there's very little inflammation underneath. Compare this to where there is bacterial dysbiosis. This is where the health of the lining of the or at least the lining of the intestines is significantly compromised. Much less production of mucus, very far fewer both numbers and types of bacteria. The integrity of the intestinal wall is compromised. There's significant inflammation below here due to the transport of large proteins and even bacteria through the epithelial wall. And this then leads to immune dysregulation. What effects do different diets have on the microbiota? It's been found that a high total protein intake, especially animal protein, increases the risk of inflammatory bowel disease by up to 3 times. Another substance which is generated by certain bacteria that are promoted by the intake of red meat is trimethylamine, which when it is absorbed and goes to the liver is converted to trimethylamine oxide, which is pro-atherogenic, increases also the risk of diabetes and also chronic liver disease, and also chronic kidney disease. A low-fat diet increases the bacteria that result in reduced fasting glucose and total cholesterol. Now, this was an interesting study that was performed as part of the Adventist Health Study 2 research. You'll notice here how that different diets, the vegetarian, semi-vegetarian, and non-vegetarian diets, how they influence all the factors that we talked about involved in metabolic syndrome. HDL is increased, which is good. Triglycerides are decreased, which is also good in the vegetarian diets. Glucose levels tend to be lower, blood pressure levels are lower, waist circumference is significantly less, and the body mass index is also lower. Now you'll notice here that looking at the diabetes prevalence, comparing again different diets, the non-vegetarians, meat eaters, diabetes prevalence was 7.6 in this group of 60,000 participants, compared to vegans, plant-based, which was 2.9. That's almost a 3 times lower incidence of diabetes. And look here now at the body mass index. Not as big a difference, but you'll notice that non-vegetarians tended to have a body mass index just below 30 compared to 23.6, which is considered to be normal for vegans. Ultra-processed foods is becoming the scourge of modern diets. First of all, let's look at the definition. Ultra-processed foods are formulations of many ingredients, mostly of exclusive industrial use, that result from a sequence of industrial processes. And the best way to know whether the food that you're eating is an ultra-processed food or not is to look at the ingredients. If the lower the number of ingredients, the less processed it is. If the ingredients consist of a whole lot of chemical substances that you've never heard of, it's very likely to be an ultra-processed food. Quite a number of studies have shown that there is a strong correlation between the ingestion of ultra-processed foods and metabolic syndrome. Ultra-processed foods are rich in saturated fats, added or free sugars and sodium, and poor in dietary fiber and micronutrients, all which are known to favor metabolic syndrome. There's also an evidence of increase in microbiome-mediated inflammation through the additives and the absence of fiber. Now let's look at the scale between unprocessed and ultra-processed foods. Here is an unprocessed food, a potato. Okay. The only process that you might need to do is chopping it and peeling it. What about a minimally processed food? Here is a cooked or boiled, baked potato. There's maybe some pressing, refining, milling, drying, but minimal ingredients have been added, maybe some salt and oil. What about a highly processed food? Here we've converted that same potato into a bunch of French fries, more ingredients, and then the ultra-processed is, of course, the crispy chips, made mostly from substances extracted from foods such as fats, starches, added sugars, and hydrogenated fats. These are food-like substances. Okay. So the more the processed the food, the less you should eat. Here's another example. Okay. Look at grapes. If you eat them like that, maybe just washing them and cleaning them, and then you can process those a bit further, cooking, making juice, pressing, refining, drying them, making raisins. Highly processed would be canning, pickling, smoking, and curing, and then the ultra-processed making grape juice or wine. Now, stress also has a significant role in the development of metabolic syndrome. And there are a number of different types of stress, but it seems like the ones that are most strongly associated are work-related stress and financial stress. This feeling of defeat or helplessness, particularly amongst workers or in financial crises. What about sleep? Only 65% of the US population, this was back in 2014, obtained the recommended amount of sleep, which was 7 to 8, it's mentioned here, 9 hours, but in fact there's a significant difference between healthy sleep and either too little or too much sleep. So sleep between 4 to 7 hours or more than 8 hours increases all-cause mortality. That's quite a statement. But notice this, that visceral adipose tissue is increased for short or long sleepers, and we do know that visceral adipose tissue is strongly associated with the development of metabolic syndrome. There's a strong correlation between sleep duration and insulin resistance in type 2 diabetes, and also between sleep and coronary heart disease and all-cause mortality, or particularly mortality from coronary heart disease. Sleep deprivation affects the appetite, cortisol levels, chronic inflammation, even epigenetic effects on gene expression. That's amazing. And dyslipidemia. And then obstructive sleep apnea can affect insulin resistance, hypertension, chronic inflammation, dyslipidemia from oxidative stress and hypoxia. There is an inverse relationship between higher fitness and the development of metabolic syndrome. Exercise counseling is mandated in many health systems because it is so important in controlling this and other non-communicable diseases. But unfortunately, it's not often carried out. Notice the specific effects. It helps to reduce weight, reduce blood pressure, improve lipid disorders, and reduce insulin resistance. Sorry, let's go back. What about psychological well-being and metabolic syndrome? Evidence supports an independent health benefits of positive psychology and well-being. Now, this has a number of mechanisms. First of all, somebody who is feeling good about life and has a good self-image and a good sense of purpose in their life is much more willing to look after their health and to engage in healthful behaviors. Positive psychological well-being is positively associated with restorative health behaviors and biological function, and inversely associated with deteriorative health behaviors and biological function. Now, just to summarize what we have been speaking about, I've drawn up this little illustration. Might look rather crowded, but let's go through it. We spoke earlier about the role of saturated fatty acids in insulin resistance as well as in chronic systemic inflammation. Notice that at the base of all of this is chronic systemic inflammation. And chronic systemic inflammation can increase insulin resistance, and insulin resistance affects chronic systemic inflammation. We spoke about dietary fiber deficiency and how this results in decrease in short-chain fatty acid production. It also affects the gut wall integrity and results in intestinal dysbiosis. Ultra-processed foods also have an effect on the gut intestinal flora, and also increasing or decreasing short-chain fatty acid production. We know that when there is a disturbed intestinal flora, this results in greater gram-negative bacteria, an increase in lipopolysaccharide production, which also causes increase in systemic inflammation. A diet that is high in animal proteins also stimulates the production of bacteria which produce trimethylamine, and this then is converted to trimethylamine oxide, and this increases chronic systemic inflammation, atherosclerosis, diabetes, and chronic kidney disease. Sedentary lifestyle, sleep deficiency, chronic stress can all influence not only our diet but also increase insulin resistance and chronic systemic inflammation. Living without purpose, living without good social relationships and loneliness can all increase bad behavior, health behaviors, and result in further chronic systemic inflammation and insulin resistance. So you can see how all of these are interrelated, and it's important when we are trying to reverse metabolic syndrome to look at all the many factors that are involved. But perhaps the most important are the dietary factors and the importance of exercise in doing these, not to minimize the others as well. Now, here is a well-known illustration that was commissioned by Dean Ornish many, many years ago. He's a doyen of lifestyle medicine. Conventional medicine has become ever more sophisticated at mopping floors. Much of our time as doctors is spent in this fruitless exercise. Surely it is more rational to combine the mopping of the floor with turning off the tap. Uh, Only then will the problem be resolved, because not only are we dealing with the consequences but also the causes of the conditions that we are trying to deal with. Now, these are the 6 pillars of lifestyle medicine. First of all is a healthy diet made up of whole plant-based foods. These increase the amount of dietary fiber, they increase the amount of phytochemicals and minerals and other positive substances which promote health. They provide all the requirements for our health as well. What about physical activity? We have spoken about the importance of that. How about managing stress? Developing strategies to be able to manage our stress. Positive psychology is one of them. Exercise out in nature is another one. Building relationships is another way to reduce our stress. Improving our sleep, very important. Getting enough sleep or avoiding too much sleep, and avoiding risky substances like tobacco and alcohol can also have an important role to play in controlling metabolic syndrome. We've lost our presentation. A study that was done in New Zealand by a group of GPs. They noticed that they had a very high number of patients suffering from obesity, hypertension, and type 2 diabetes. All these patients received routine medical care, but the intervention group were put onto a limitless whole food plant-based diet. In other words, they were not restricted in how many calories they could eat. They could eat as much as they wanted to of a whole food plant-based diet. They also received 12 weeks of 2-hour group sessions. And notice the differences between these two groups. The control group, there was actually an 8% increase in medications used during that 1-year period. HbA1c was unchanged, so it didn't really affect diabetes, the conventional way of treating patients with diabetes. There was only a 1.6 kilogram decrease in weight. And compare this to the intervention group, where there was a 29% decrease in the medications, a decrease in HbA1c. In fact, 2 participants had completely normalized HbA1c during that period of time, and a significant 12.1 kilogram decrease in weight compared to a 1.6 kilogram. So this was a study that was done with very little fancy interventions, and showed that even as GPs we can make a big difference in the lives of our patients. Now, this is a patient that I had, one of my colleagues that was working in theatre. She was 38 years of age. Her name is Gugu, and she gave me permission to tell her story. In 2010, during her first pregnancy, she developed preeclampsia, and this went on to produce chronic, quite severe hypertension, which was treated by a specialist physician with 3 different medications. But in spite of that, she developed early heart failure, and in fact ended up in hospital at one stage with heart failure. She was so keen to have another child, but because of her hypertension, this was ill-advised. In July 2021, she came to see me and she said, she was so frustrated. There was no improvement in her blood pressure, and wasn't there anything that I could offer her in terms of lifestyle medicine that would help her to improve. She had seen the benefits of lifestyle interventions in other patients and nurses that I had spoken to. So we put her onto a whole food plant-based diet with no restriction in kilojoules, and she was very willing to learn, and I spent just a few hours in talking to her about how to go about this from time to time. Her blood pressure dropped in the space of 4 months. Her blood pressure dropped from systolics of 200, diastolic 100, down to about 120/70, and her medications were reduced by half. And during the same period of time, she lost 14 kilograms. and by 2 months later she'd lost another 4 kilograms. At the early onset of her intervention, she developed mild COVID. This is in August of 2021, and many of her colleagues were becoming very sick, some of them even ending up in ICU, and yet she had a very mild form of COVID. She came from a strong family history of hypertension, but when they saw the benefits in her life, they were quite willing to adopt her behaviors as well. Notice her comments. I was not expecting to live beyond 60 years with my high blood pressure. I could not walk very fast and was short of breath. Now I can run. I'm feeling really healthy and even more happy with my weight. And there's a picture of her before and after the 4 months. She feels just so much better, and it's amazing what a difference a person can feel just in such a relatively short period of time. A common excuse by clinicians for not addressing lifestyle factors is that they believe patients are not interested. However, research shows that this is not the case. Perhaps the greatest influence is whether the practitioners themselves are adopting a healthy lifestyle. Notice that a good patient-doctor relationship provides the best platform for effective discussion. Here are a summary of some of the provisions of lifestyle interventions in consultations. First of all, every consultation is an opportunity to introduce the subject of preventive interventions. Even if a patient is coming to you for a sore throat or for a skin infection, one can talk to them about maybe a person who's in their family, a diabetic, a hypertensive patient, somebody who's battling to overcome smoking. These are all opportunities, and it might just be a gradual or a short mention of interventions that are possible, or a 1 or 2 minute discussion. It's always important, particularly if you're talking about obesity or addiction problems, to obtain consent from the patient to talk about those things. A human organism is exquisitely designed to heal if given the right environment and prerequisites. I've heard of people, in fact there was a study that I read recently that showed that even people who are 80 years of age, if they adopt a whole food plant-based diet and start exercising, can increase their quality as well as the quantity of their lives. Notice that patients need self-autonomy. You cannot impose lifestyle behaviors on patients, and the paternalistic approach is often counterproductive. It's important to share the possibilities of improvement or reversal of chronic disease through lifestyle interventions. So often patients don't realize that they could actually, if they were willing to adopt the changes that are recommended, might even be able to stop their medication, and they certainly would feel a whole lot better and healthier within just a few weeks of making the changes. So let's summarize. Metabolic syndrome is primarily caused by reversible lifestyle behaviors. Now notice this rather strong statement, but I believe it is correct. To treat patients with metabolic syndrome without addressing these factors is substandard care. So we cannot just dish out medicines and tell patients to keep on coming month after month for their follow-up without talking about what causes the conditions in the first place. Patients need to know what the possibilities are for improvement. They need to know that they could maybe even reverse or certainly improve their diabetes and their blood pressure by adopting these behaviors. As their practitioner, you have the opportunity to partner with them in a journey. This is a journey. Some people have a long journey, others need a mindset before they're willing to start on this, and others are really not interested. Sometimes it takes a heart attack or a major fright to make them start thinking about making changes in their lives. Here is a list of references which we have for this presentation, but I would like to If you would like to receive a detailed copy of the references, by all means contact me at the following email address, and I will be happy to forward those to you. Thank you very much for your attention.
Yeah, I think on behalf of everyone, Dr. Price, thank you so much for everything you shared with us. There was just a wealth of information, and I think you really summed it up at the end so well when you said that if we aren't discussing all of this with our patients, we really not treating them and not being fair to them. Personally, I really loved the slide you made with the little bubbles and how it all contributes to that chronic inflammation, and it's all so important. And I think there are factors there that, gosh, I don't even know if any of us are so really cognizant of, but things like loneliness that, you know, has been proven to be such an important role and factor in terms of longevity. So I would really like to open the floor to any questions and any comments that people would like to share, even just stories. I think your case study was inspiring for anybody looking to lose weight, I guess, themselves, but for all of us to really be motivated to work with our patients. Okay, see, we do have some wonderful questions coming through. So do you have any other case studies, especially around women's health, that you found improved, especially with the move towards a more plant-based diet?
Well, I do, but we are going to be having a special presentation webinar on that subject in the future. But just just briefly, we know that it can significantly reduce menorrhagia and dysmenorrhea, in other words, painful and heavy periods. I've heard some amazing stories from Dr. Barnard about effect on endometriosis. In fact, one of his workers had a dramatic reduction. She was at one stage advised to have a hysterectomy, and yet she wanted to have children. And then she went on to a whole food plant-based diet and other lifestyle behaviors. And just a few months later, when she went for her surgery, they discovered that she didn't have endometriosis anymore. She's gone on to have, I think, 2 or 3 other children since that time. So those are some amazing stories. And there was a very long webinar that was presented at one of the conferences, I think it was a Plantrician conference, which went through a whole range of female women's health issues and showed the benefit of lifestyle involvement. So that we will talk about. I think it comes up in August or September sometime then, but we'll certainly cover those.
Yes, absolutely. Thank you for giving us a little bit of a taster to our Women's Month August focused webinar. But I think that's a very inspiring story, and it definitely, I think we've all experienced patients who are struggling with fertility, and it's a terrible situation. So anything that could help them is something that we should be discussing with them openly. Bronwyn actually asked such a brilliant question that I think is just, we all want the answers to. In your opinion, if a patient wants to start with lifestyle change but feels exceptionally overwhelmed because there are just so many factors and they don't know where to start, what would you recommend as the lifestyle change for them to start with that could be the most impactful for them to choose? So exercise, sleep, alcohol, what do you feel would be the best one for them to start with and is the most impactful out of all of them?
The answer that I'll give goes back to my days when I first started on health prevention and community health in Lesotho. That was like 30 years ago. 40 years ago. And the principle that we have there is you start on what the patient feels is the biggest problem. So, for instance, in Lesotho, the biggest problem that I saw was infectious diseases, things like diarrheal diseases, TB, those kind of things at that stage. And when we got a whole group of the community leaders together and we asked them, what do you consider to be the most important thing, and what do you feel are the health needs? Just about all of them said, well, we think we need to have clinics. We don't have enough clinics. We don't have enough nurses. But another important one was they said that our water systems are not well protected. So we started our program by improving the water systems, even though there were other, if you looked at the statistics of the diseases that were affecting most people, it wasn't water related, because I mean, there's plenty of clean water in the city. But we started with what the people thought was the most important. And then once they had our confidence, then we were able to work on the issues that were more relevant to their healthcare in the future. And so this is a principle that you have also when you're working with patients, is you try to identify what they consider to be the main factors and what they would find to be most appropriate to work on together. And remember, it's a journey. So if you throw everything at them, they're going to just crumble, they're going to give up because it's just too much. But if you start with one or two things and they start feeling the benefits of that, then you can start working on some other factors as well. If that's answered the question.
Bronwyn, I don't know if you want to answer your question, but I think that's very sage and brilliant wisdom, because meet your patient where they're at is probably a great, and I guess that's a good one to say, go with what they feel most excited and passionate about, because sometimes it's hard to get people to change. Bronwyn, would you like me to read your second question, or do you want to ask it? Because it's really good. Okay. So what battery of test measurements would you use in practice to evaluate a patient's metabolic state in both thorough and cost-effective manner if they're interested in knowing and changing their current metabolic risk factors as well as metabolic disease profile?
Okay, well, we of course mentioned at the beginning about the diagnosis of metabolic syndrome. Obviously, your fasting blood glucose, your HbA1c, looking at your lipids, that's important. In some cases, there might be a need to look for renal functions and liver functions. But I think generally speaking, and of course the abdominal circumference is very important as well. But I think in generally, one doesn't have to go into doing a lot of studies, a lot of laboratory work, because it's relatively simple to be able to implement some of the changes that are necessary. I also would do a CRP just to measure signs of chronic inflammation. And of course, the full blood count is helpful as well. And I also like to do a B12 and a folic acid, just to make sure that where we are in terms of changing lifestyles, you want to make sure that they're getting B12 supplements as well. Another one that I like to look for is vitamin D, because this has been found to have quite an important relevance in treating our patients. So those are the main ones that I would look at. No, I don't go along with doing a whole battery of tests. It becomes very expensive, and really, is it that necessary?
That's really helpful. And I agree. I think, to go and kind of wipe out patients' medical aid or savings, whatever it may be, is off-putting to them and makes them feel quite frustrated. How often would you feel then you would want to monitor these, even things like abdominal circumference or weights? Often we see even friends, forget just patients, being like, every week I'm weighing myself, and it just seems like a very counterproductive activity. So how often would you encourage retesting, basically?
Well, it depends, of course, on the severity of the condition. I mean, if a patient is diabetic, then you want to do that on a monthly basis, the HbA1c, just to see which way things are going. Obviously, the HbA1c is a long-term thing, but it's amazing, in spite of the fact that it is long-term, how quickly it starts to reduce. So I think that's also very encouraging to patients to know that things are improving there. Obviously, your glucose on a regular basis, patients should be recording that and monitoring it. Blood pressure, as we mentioned with my face presentation, I mean, things drop very rapidly. But I think probably a monthly check of the basic parameters and then maybe 3 monthly checks of doing lipids, and that would be helpful.
Thank you so much. I think that's very helpful. It's a nice mix of getting results to give that positive reinforcement, but also being patient and not doing harm in a sense, especially to patients' pockets. I think those are the most amazing questions, and I know I am cognizant of the time. I don't want us to run late. So a huge thank you to Dr. Glass for the time and effort he put into this preparation, this presentation, and the wisdom he's shared. Thank you so much to everyone for attending. As always, the recording will be sent, and there will also be an email being sent out with just 2 quick questions for our CPD points. That is also always wonderful. And we're really looking forward to seeing you in all our future events. Please don't forget that if you sign up by the end of, if you aren't yet a member, if you sign up by the end of May, you stand a chance to win an A5 valued at 1,750 Rand. And A5 is awesome. And load shedding friendly, because you can make things really, really, really quickly, like even a cake if you need. And if you are already a member, please share it and get your friends to sign up, and let them, if they win the air fryer, take dibs on obviously dinner at them. Sorry, Dave, were you going to say something? I'm sorry.
Yes, I just wanted to say thank you so much, Akira, for organizing this, and Roxy. The slide quality is just fantastic, and I'm very proud of the slide presentation, but that was thanks to Roxy. So I really appreciate that, even though you're in the States, you still are helping us with SALMA. So thanks very much. I really appreciate it and enjoyed the time that we could spend together. And hopefully this will become a regular event with all of us.
Amazing. Have a great, great evening. And thank you so much for sharing with us tonight and learning with us. And everyone, just enjoy the rest of your public holiday, and feel free to reach out if you have any more questions, comments, thoughts, as always, over social media, email, etc. Bye.
Bye.